Happy Wednesday Wellness.
Woohoo!
Woo! It's just us two today.
I think our last one was, we haven't even posted our special guest one yet.
Oh, we haven't?
No.
It's probably going out tomorrow.
Yep.
We are talking about ear infections today.
Yes.
Yep. For Wednesday Wellness.
Yep. Chronic ear infections.
Yeah.
Common.
Super common. It's like the start of kind of like that season 2 where everyone's starting to get like, you know, sinus viruses, that kind of stuff. I mean, we have number one sugar holiday, Halloween.
Yep.
Tomorrow, so.
Yep. So we're talking about chronic ear infections, why are kids getting them, frustrated, burnt out parents, like what can you do instead of just continually going to your pediatrician or showing up at the ER, getting the same, you know, we'll see kids with multiple rounds of antibiotics for the same ear infection, you know, it's not helping.
Yep.
You're dealing with a kid that's in pain and crying all night and like they're usually pretty miserable when they have an ear infection.
Yeah, yep.
So, and they're common, like I said, 80 to 90% of kiddos before the age of 3 will have an ear infection.
Right, yeah.
Some of those, like I said, are like consistent. Like anytime a kid gets sick, like their mom knows, oh, hey, they're going to get an ear infection.
Right, exactly. Or sometimes like that's the first sign that they're getting sick too.
And also I think they like are like, oh, do they have one? Do they not? Like, you have to take them in to have them look in their ear to know, like, you know, it's just a whole thing.
Exactly.
It's a lot, especially when you're working, you know, too, as a parent. So.
And ear infections too, I mean, so, like, it's not always bacterial. Like, some of them are viral too, and there's tons of viruses going around right now. But what can happen is, like, if things aren't draining properly, then that creates a breeding ground for bacteria and viruses too. So then,
how we see ear infections usually start, let's say, like, what causes an ear infection is a buildup of fluid, right, with bacteria in it. It can't drain, gets infected. They have pain, it's inflamed.
Yes, there's pressure.
There's pressure.
You know, so that's,
So it's a lot of times they lay down and then they feel all that pressure and pain. And so from a chiropractic standpoint...
Which this can also happen during teething too.
Yeah,
because of the inflammation again too.
That's a good point. Yeah, really, really good point. really great point. Of a chiropractic standpoint of how we can help, because like how we say, like, this is how we have a nice picture of like how what we do can help and maybe what is happening in your kiddo, especially if they've never been to a chiropractor like since birth at all. Like, okay, how could this be like related, like their birth story even, to why now they're getting chronic ear infections?
Yes, exactly. So the biggest thing that we talk about like in our practice when it relates to ear infections, there's a couple of different aspects of the nervous system that control areas of the ear, that control like the drainage and stuff too. So we talk a lot about like the C1, C2 nerve root, but little anatomy lesson for you here. So we've got, this is the ear. Yeah, please. Okay, so here's our ear. Here is our eardrum right here. So this is like where we're looking in to see if there's fluid in the inner ear right here. So when we're looking at the ear canal and the eustachian tube as it's going down and draining into the sinus cavity, so this is like in our ear draining down the back of our throat here, there's this little muscle right here called the tensor veli palatini, and that muscle is responsible for milking the fluid down the sinus cavity so that it drains down the back of the throat. So when this muscle isn't working, we can have that buildup of fluid there. This muscle is innervated by the C1, C2 nerve roots right here too. So C1, C2 are the top 2 bones of our spine. So those nerve roots that exit in between those are the nerves that control that little muscle. So if things aren't communicating, like we talk about subluxation and nervous system dysregulation, if we're not getting good communication through that nerve root, then that muscle's not going to be functioning the way that it's supposed to. So again, that subluxation can be caused by inflammation. It can be caused by just like irritation, stress, birth trauma. It can be caused by, you know, we're getting inflammation just from like the swelling of the gums and baby's not sleeping well, so now our muscles and everything aren't working as well.
Yeah, so that's subluxation. Yeah, say most common, right? We always say birth trauma, how baby was born. Was it a traumatic birth? Was it a C-section? Were there forceps? Were there a vacuum? Was it just a long labor? Did they push a long time? Did they come out really fast? All of those can create a subluxation in that upper area, C1, C2. C3, I'd even say, is like a common area for ear infections.
Yeah.
But say you had a really happy baby, right? And like, I'm not bringing my baby to the chiropractor. Why would I bring him to a chiropractor? And so that's never been checked. And now, but they have these issues. Maybe they have an older sibling, right? So that they're getting sick. So the young one's getting sick, and now the young one's getting ear infections, or they both are.
Yeah, exactly. A lot of it is, just because of that buildup of fluid in there.
Yeah.
So How do we
take care of it?
How do we take care of that? Well, number one, we always do scans in our office to see if this could potentially be a thing that's like being affected here too. So we have a couple examples of scans from some kiddos. So these are before and after scans. So the befores are down at the bottom here. So this is one kiddo. So at C1, we had like a 4.2 degree difference. He was chronic ear infections. Like that was kind of the way that mom always could tell that he was getting sick, was like he would start getting an ear infection, just had to go straight to antibiotics, was getting them like chronically. Big brother would come home, pretty much the story you just said. Big brother would come home from school or daycare, bring a virus or bacteria home with him, and then he would show up with an ear infection, and it was really bad around the times when he was teething and stuff too. On this one, you can see all of this like cooling here. That means we've got some stuck stress in the nervous system. Everything's really one-sided and shifted over. It's because there's this big subluxation going on right here at C1. So then this is a follow-up scan. Like he's been good. I don't think he's had an ear infection in like almost a year. And this is a pretty recent scan, so you can see just everything is much more regulated in here. In this scan, we still have a little blue. Like these are just some areas where there is still like some of that stuck stress. So we're still recommending he come in just to like make sure that everything's stable.
Well, because kids also just go through stress. Like your body's adapting. Like they're still going to be like subluxated, but like take care of it, right?
Exactly.
And that's the thing. The moms are just like, I've had him on so many antibiotics. It's not taking care of it. They want to do tubes. Parents are scared to have their kids go through surgery and do tubes. And sometimes we have plenty of kids that show up here with tubes that are still getting ear infections. Yeah. Because the problem was never taken care of.
Well, right. I mean, you're relieving pressure from kind of the wrong side of the system. Like you are still like maybe giving a tube to like allow for some drainage, but those tubes can get clogged. They can cause, there can be other secondary infections from any surgery. There's always issues that can come up with surgery.
Yeah. It's just scary to have your kid go under.
Absolutely.
I can't imagine.
Yeah.
I know it's like a common surgery they do. It's still just scary.
Yeah.
Okay, so this is a little girl. I saw this mom called in like a panic. Oh my gosh, my kid's on
I'll hold this for you.
I don't know, another ear infection, and they want to do antibiotics again. And also the thing is, kids don't always fare well on antibiotics. They end up with diarrhea. We're creating a whole gut biome disruption. Like there's a lot more that goes on in your gut than just digestion. There's our serotonin there. So emotional. That's like an emotional regulation thing.
Yeah, I mean, it also affects like how we're going to respond to future illnesses. Like it affects the immune system being on antibiotics.
Yes.
I mean, because again, you're wiping out all the normal flora too, which like our own like probiotics that we have like on our skin, in our gut, are super important for how we respond to future viruses, how we respond to allergens, and like so seasonal allergies, that kind of stuff can all be affected by that. But like you said, serotonin, mental health aspect of kids' gut health is like pretty astronomical. We're finding out a lot of things, especially in sensory kiddos, kids with autism, ADHD. If their gut's off, it's
like huge impact to it too.
Huge impact.
And like I said, these kids are mostly on like, she's on her third round of antibiotics for this, like, and she still has an ear infection, is usually what's happening.
And it's like the same ear infection.
Like it's never cleared up.
Yeah.
So we can see again here in the originals,
initial
we
scan
have those
here.
subluxation. I mean, she had it a lot, C1, C2, C7, a lot going on.
Yeah, I mean, the temperature, it was like 3.2 on this side, 2.2 on this side.
And I will say she's an active ear infection here also. Yeah. Like she came in like,
her body's inflamed. We got some,
evening, like please get her in. I don't know what to do anymore. Please help. All the blue here, the stress we talked about before, that tells us that, hey, like kiddo's really stuck in fight or flight. She did like her normal care plan routine, got rescanned. We could see all of that cleared up. So kiddo's out. They're sleeping better now. Like other things happened. They came in for an ear infection, but hey, they're sleeping better now. Yes. They're just emotionally regulated better. They don't, when they get sick, she's not getting as sick. It's not going to an ear infection. Just kid's a toddler. She's in daycare. It's not that kids won't get sick. Kids get sick, and it's okay to get sick. It's how your immune system's going to handle that sickness.
Well, and like how quickly we can turn over, like how quickly our body can learn how to deal with that sickness. What I want to point out on this scan, which I love so much, is like this one right here, all this red, we want to see red on this one. We want to see red, increased blood flow as we're approaching the brain. So this means like her capacity for healing is kind of at the max right now. Like this is really, really good. We still have some colors and some stuff showing up on here. You can see like like, we had this huge subluxation pattern on this initial scan. This regulation is so much better. And even though we still have some colors here, we've like made huge improvements. And this is her body reorganizing all that information too.
And she hasn't had an ear infection since. Like I said, she's had colds. She comes in, she gets adjusted, and her body can drain it, and she doesn't end up in an ear infection.
Yes. Awesome.
Which is great.
Snaps to
life-changing for parents. And the kiddo.
This is another kiddo. This is an older scan. You can tell we haven't done some follow-up scans on him. But he was, again, chronic ear infections, chronic sick. He was like always the sick kid of the family. Like the older sister, like hardly ever is sick, but she had some other stuff going on. But right here, I mean, his was just C2, C3. Like he didn't even have that like big atlas subluxation. So that just goes to show like it's kind of how things work together. All these nerves branch together. They communicate with each other. C2, C3 has a lot to do with that drainage area too. And so again, when we did a follow-up scan, just huge improvements.
And I will say all about all these 3 kids, like their parents were committed to the care plan.
Exactly.
Right? Like they came in for their adjustments when they needed to. They didn't expect to be adjusted twice and have life changing. You know, they did what, and they continue to bring their kids.
That's why they have follow-up scans. Is because they went through a care plan.
And then they still come in. Like they still come in for their maintenance, and they come in extra when they need to, when they're sick, when we talk about. Like they get it, they understand it, and they see great results. And like they aren't on antibiotics. They didn't have to get tubes, all those things. Yeah,
so those are the benefits of being under like regular, consistent care is like not only, I mean, if you get adjusted when you have an ear infection, chances are it's going to help you drain. Like we do have families that do that too, but the consistency is the key to like longevity and like the change over time. So if you don't want your kids to like keep going through that cycle of like, well, they have an ear infection, I'm going to get them adjusted so they drain now, but it's probably going to come back because we're not really like correcting the issue over time. But if we're
or it's like I said, it's usually a kid gets sick. Okay, well, hopefully, like if you're continuing care more regularly, your kid gets sick, it doesn't get to a point where they're going to get an ear infection. You know, they're able to clear it out, they're able to drain it, their body's able to fight it. Hopefully, their body's not in fight or flight anymore, so their body can focus on their immune system.
Yes, exactly. Yeah.
So anything, even if your kid's not an ear infection, but your kid's a sick kid, it's also important to get adjusted.
Yeah.
Cold season, sugar season,
holiday stress.
Holiday stress.
It's all coming.
It's coming. I have been more vigilant. Yeah, vigilant. On adjusting my own children. So I'm really trying to keep them healthy this season.
Yeah, I mean,
my kids have never had an ear infection. That's just not because we have good genetics. It's because they've been adjusted since birth regularly. Yeah. They've had plenty of colds. They've had plenty of fevers. Yeah. They've had plenty of illnesses.
Which is, again, all good. You want to be able to bounce back from it. Like, everyone's going to get sick. You want to be able to, like, not let it take you down for months at a time.
Some other things, like, advice to give, like, hey, if your kid's in an active ear infection, when they're here getting adjusted, like, to help with the pain, things you can do at home to help the ear drain. Like, those are things we can also help you with.
Even, like natural remedies and stuff like that, too, to help with. So, yeah.
All right. If this sounds like your kiddo, obviously you can give our office a call. You can text us. You can message us. Whatever questions you might have.
Yep.
All right. Have a great day.
Have a great day.